welcome back to another edition of TCM Graduate TV. I'm Kenton Sepsic, registered acupuncturist. This is episode 79, and today we're talking about UB23, 24, 25, and UB26. Last episode, I spoke on UB23, and it got me thinking about all the acupuncture points that remained on the UB channel for the back, and how I don't use them as heavy hitters per se, singularly, but I use UB23 through UB26 as a group, and I have been doing so for many, many years. And I want to tell you why. Patients will come in, they'll tell us they have low back pain. They'll also say that they have soreness and weakness in the knees, hot flashes, night sweating. Maybe they are showing signs of having poor stamina throughout the day, cracks on the tongue, pulses are weak in the kidney department, so they clearly have low back pain due to kidney deficiency. So I'm definitely going to treat UB23. Kidney Qi, kidney Yin, kidney Yang deficiency, maybe not Essence, maybe UB52 I think does a better job. You might like to use for kidney Yang, kidney 7, Moxa on Ren 4, Moxa on Du 4, whatever the case may be. But we have to treat the kidney deficiency, and what better way to do it with the back shu of kidney? UB24 is pretty cool because it's the Qi high of the back. It's the Ren 6 of the back. Also, if a patient comes in and tells us that they have pain that goes from their low back, maybe through to their buttock, down the UB channel a little bit, switches over to the GB channel, maybe switches back over to the UB channel, etc., maybe wraps around the leg to the front of the leg. These are all the dermatomes from L1 through to L5. And sometimes I'll do one above UB23, I'll do a UB22 in that case, because the medial thigh is L1, lateral thigh is L2, the lateral leg, where the GB and stomach channel goes, is L3. The medial lower leg, where the spleen channel is L4. And then the foot and toes are L5S1. So it's really important to treat all of it to make sure that we get all the dermatomes and the nerves that are associated with that area, get them treated. So what's also cool is that if I can augment somebody's Qi from a back treatment, why wouldn't I? Stomach 25 is the front mu collecting point of large intestine. So 25, UB25 is the back shu. That's how I remembered that when I was studying. I've got a stomach 25, UB25, and that helps me remember the mu shu acupuncture points for large intestine. Our body communicates in a very interesting way. If a person's having a heart attack, they don't feel like their heart is having pain. It refers down their arm, maybe up into their jaw, etc. In terms of bowel concerns, constipation, Crohn's, colitis, inflammation, whatever the case may be, they often feel it in the back. And I believe the ancients were quite smart when they marked out these mu shu acupuncture points this way. Many times in clinic, I treat a patient's lower back pain. They might have some bowel concerns that they don't think is that important. Oh, I'll only have a bowel movement once every 5 days, no big deal. And then I'll treat their low back, again, 23 through to 26, and the patient will say, "Did you do anything for my bowels?" Why do you ask? Well, I'm going every day and it's fantastic. That's great. So there are so many times that our body's communicating, so when we treat acupuncture points such as UB25, we can get some really cool results, such as helping bowel concerns that weren't our main goal, but maybe that's where the body's communicating in a different way. UB26 is a really important acupuncture point because we go from the lumbar vertebrae to the sacral. It's that bridge point. And if you've been in practice for any amount of time, you'll know this is where almost everybody has lower back pain. Its Chinese name is something of the like of spine support. It's the last one that kind of holds the whole spine up. So why wouldn't I treat this acupuncture point regardless of whether they have back pain at this point, which is most likely that L5-S1 joint? But it's really important to treat this area, and it's often quite sensitive in patients, and they get such a great result for it. So this is going to support the whole spine by treating UB26. Of course, I have to mention again UB40, the key or command point for the low back. If I'm working in this area, I'm going to augment my treatment by using UB40. There you have it. Lots of heavy hitters when used together. Just want to remind you that safety is king, bedside manner is king, and results are king in that order. Thanks for watching this video.